author of a book called The Pain-Free Mindset. And in that, I try to bring in many of these lifestyle medicine principles to managing and helping patients overcome their chronic pain itself. And I have, although it's called mindset, the mindset also works doubly as an acronym. And the acronym is so that the M is for medications, the I is for interventions, the N is for neuroscience and stress reduction, the D is for diet and microbiome, the S is for sleep management there, and E is for physical activity and exercise, and T is for therapies of mind and body. And I tend to almost, in my mind, have a similar construct for looking after long COVID patients, is to apply that same mindset concept to overcoming long COVID as well. And at this point of time, to me, it seems like a good framework to look and make sure that you've got everything in place for supporting your long COVID patients. So first things, the key tips there, with regards to medication, a lot of long COVID patients in social media and around are reading up, and they're finding out that sometimes there may be an element of mast cell. Mast cells are a particular kind of immune cells which seem to become overactivated, and there is a multi-system disorder called mast cell activation syndrome, and some patients may have a mast cell intolerance. So there is a suggestion that antihistamines may be of benefit. So there is a possibility that within the medication, the M part of it, there may be a role for antihistamines, 4 to 6 week trial of such drugs. The evidence is still being looked at, but it is fairly low tech, and it's easy, and it is available widespread in the GP land. So something to consider for your patients. If it is cardiovascular system and they have tachycardia or palpitations, there may be a role for beta blockers or other drugs like ivabradine. If it is respiratory system and breathlessness, there may be a role for inhalers. There may be a role for pain medications if aches and pains are an issue there in shared discussion with the patients. There may be a role for some amount of steroids at suitable junctures if required. So in terms of medication, this gives a framework that these are all the drugs that could be of potential benefit in this group of patients. Then next we come to interventions, the I. What kind of intervention? So for example, with breathing, if breathlessness is still a persistent problem for long COVID patients and their spirometry and their lung function tests are broadly normal, but they're still having breathlessness, we think that this is a problem of the autonomic system. That is, their sympathetic and parasympathetic system control of their breathing is impaired. And so a lot of patients might benefit from actually breathing retraining. So there are websites, for example, longcovidphysio.org, and there are other websites for breathing pattern disorders. And then your listeners will be able to get some help for breathing pattern retraining for the patients. This might be something as simple as breathing exercises like box breathing or 3-4-5 breathing, but there are other ways as well that this can be taught, and the physios can help in that. In our local area, we have a collaboration with the English National Opera who are using singing as a way of getting that breathing retraining as well. So innovative approaches can be looked at there. If there is smell problem that is persisting, then smell retraining is an option with a charity called Absent. So that's an option there. And there are musculoskeletal rehabilitation. Again, it may be another form of retraining, of gradual improvement using pacing techniques. That can be an intervention there. I think there are no big surgeries or injections that have really come up as suitable for long COVID, but there are always going to be some groups of patients who may need to be assessed and individually looked at to see whether there may be other interventions that could work. Next is neuroscience, the nervous system and stress management. Sometimes talking to patients, one of the biggest things that long COVID patients coming to a clinic like ours have said, they feel validated when they've been listened to, when they've been understood, and they can understand that there are more people like them suffering the problem and that they are not alone. So sometimes the sheer understanding of the condition and listening to the patient can be a powerful validation and reduce their levels of anxiety and stress that they feel. But again, that stress management can be a lot of the techniques that lifestyle medicine diplomates already learn, and that can be the same stress reduction techniques that can be incorporated into here. So a variety of mindfulness-based approaches can be incorporated and brought into here and provided for the patients with this as part of stress reduction techniques and anxiety management techniques there. The most important, I think, in my view, is around diet and nutrition. And there is a good role for this. As I told you, if we are looking at the immune system being a problem in long COVID at this point of time, an overactive immune system, we know that the immune system is present predominantly, 80 to 90% of the immune system is present predominantly around the intestine. Combined with the nervous system in and around that area, it's almost the second brain that we all have. So using diet and nutritional techniques to rebalance the immune system and the nervous system in and around the gut is a very good strategy there. And so I always promote a kind of exploration of the anti-inflammatory diet, which may be as simple as making sure you're well hydrated, making sure you reduce the amount of processed foods, explore and embrace a whole food plant-based diet as proposed by the lifestyle medicine groups there, looking at possibly thinking about elimination of gluten or dairy or sugar. And one of the things that again is coming up because people are talking about histamine intolerance, there is a suggestion that low histamine diet. So looking at your diet and cutting out some foodstuffs that might be high in histamine could also be a potential therapeutic way of approaching it. It does need a bit more evidence base to make sure that the low histamine diet works for everyone. There are anecdotal reports on social media and on the internet that low histamine diets can be life-changing, but the evidence for it is still accumulating. So I would recommend that those of you who are listening to it, who want to consider low histamine, make sure you are working with a nutritionist or a dietitian or a lifestyle medicine physician with that particular sub-interest to make sure you're properly supported in trying a low histamine diet as part of an anti-inflammatory lifestyle. Other options I would definitely consider is to look at the time of eating, intermittent fasting techniques or making sure you eat within a time restricted window can also be other ways of making and bringing in an anti-inflammatory component to your diet and microbiome change, the use of prebiotics and probiotics. There is no evidence strongly for long COVID, but overall for anti-inflammation, I think is worth it. The next is going to be around sleep. Sleep disorders and insomnia and sometimes excessive sleepiness have all been reported in long COVID. It is a big problem and quite a common problem. And I told you a lot of the theories around why this occurs is either there is a low-grade neuroinflammation impacting on certain regions of the brain that may cause excessive sleepiness or tiredness. And on the other side, it may be that there is a low-grade neuroinflammation affecting some of the circuits, what we call the default mode network in the brain. And that can mean you're almost wired up. Your sympathetic system is on go, go, go. Your fight and flight is on go, go, go. And that means you get sleeplessness and insomnia because you just are so wired up there. So either of this means that there is a role for using technology, using wearables, using sleep trackers, using nutrition and physical activity, all those things that we study in lifestyle medicine as a way of regulating sleep hours and bringing it to that 7 to 9 hours that is recommended is all possible. But we need to understand that it may need a bit of time. It may need a few weeks of putting in variety of sleep hygiene techniques, a set of habits that we can do in the run up to falling asleep, and as well as other techniques we do on getting up. So all of that needs to be imparted. And I think lifestyle medicine does teach us those skills in how to examine, ask for the right kind of sleep questions, and then do the appropriate steps and recommendations in regulating sleep and helping patients with sleep hygiene techniques. So quite useful and very useful on that. Next is physical activity, which is a core lifestyle medicine pillar. And for me, E is kind of exercise and physical activity. This is a hotly contested and controversial area within long COVID because there's this group of patients with long COVID where they have symptoms that are very, very similar to patients who are having ME or CFS. So All this talk about graded exercise therapy, which used to be recommended for ME and CFS, is an absolute no-no. Even the NICE guidance has taken away that context of graded exercise therapy completely. And what we now think is post-exertional malaise. It's not malaise. Malaise seems to say that it's only tiredness, but people with long COVID, if they do a little bit more exertion, what they have is post-exertional symptom exacerbation. All their symptoms can get worse if they do more exercise than they planned. And there are different ways to manage it and recognize it. From my context and my understanding and discussion with my physiotherapist and my respiratory therapist and my fatigue therapist and psychologist that I'm talking with, we are now looking and we calling it symptom titrated physical activity. That should be the recommendation. I would encourage all my lifestyle medicine diplomate colleagues to read up a little bit more. I had to upskill myself in this. It's not difficult, but it is something that would be very useful to talk about symptom titrated physical activity. We want to be able to provide a very individualized assessment to our long COVID patients, and we want to then generate a personalized prescription. And we want to use these principles of symptom titrated physical activity to enhance their mitochondrial store. So if you think about it, it's almost like they have a certain amount of energy. So if you use the spoon theory, which might be familiar to some of my lifestyle medicine diplomates, is that you have a certain number of spoons, and those spoons determine how much energy store that you have. Now, COVID may cause a problem with the mitochondria within your cells. So your energy capacity and production may be impaired. So you've got two measures. One is you can determine how much is expended during the day. The other is to see how much energy you can add in over the day. Adding in is possible with dietary supplements or diet changes and appropriate energy-rich additions, antioxidants and all of the stuff. But energy expenditure, which is what we're talking about in terms of physical activity, needs to be more carefully titrated. And we need to have that honest discussion and help our patients. As I told you, a lot of our long COVID patients are people between the ages of 20 to 50, 30 to 60. These have been people who have been very fit and healthy, half marathoners, very active, very physically, gym and personal trainers kind of thing. So we need to kind of teach them about pacing, make sure that they understand what it is that their body is capable now, and work with them to gradually improve and improve. It's a difficult discussion, but it is something that we have to do and work with them to see how it can be done slowly. Because if they overdo it, this is something that is noticed in athletes. And I was doing a podcast recently with Nick Hollis, who's a mountaineer who's actually preparing for expedition where he's going to row across the oceans there. He's already climbed up the 7 peaks in 7 continents, and he's gone to the 2 poles, and he caught long COVID when he was trying to go across, just as he was preparing to row across the Atlantic. And he's had to realize that as an athlete, sometimes if you overdo it and if you don't pace exactly, you can almost get, athletes can get this called of overtraining syndrome. That OTS has got all the symptoms that are very similar to what patients with long COVID might have, or patients with ME or CFS might have. So we have to be very careful in our personalized exercise and physical activity prescription in this group. And it's something that you can bring in the elements of lifestyle medicine. You can bring in those aspects of balance and flexibility and stretching and cardio, but they need to be incorporated in a symptom titrated manner. And we need to be able to build a plan that's individualized for the patient. So very good reading, lots of upskilling that I had to do, but I would recommend that for the lifestyle medicine people listening on this. The last but not least is the T, the therapies of mind and body, which is, the healthy relationship building, that lifestyle medicine pillar that we talk about. But in my concept, I think about all mind-body therapies. Now, it might be psychological techniques like CBT and acceptance and commitment therapy, but the principles are the same. When you want to calm the nervous system down, when you want to move from a fight and flight to bring them into a rest and digest system, you want to activate the parasympathetic system that can promote calm, then we need to use whatever techniques. That can be massage, that can be gentle techniques like swimming, that can be yoga, that can be Tai Chi, that can be acupuncture, whatever has helped the long COVID patients in the past, I would encourage them to do it. We've had some funding from NHS charities, which has taken on this for us, and they have given us £50,000 to our long COVID service. So we are going to offer our patients an assortment of mind-body therapy. Some of them may have the option to do some flotation techniques in a pool. Others will be given the option of some relaxation techniques with Tai Chi, with some gentle massage techniques there, with some counseling and coaching and support techniques there. So this is all possible through some innovative charity-based funding. So all of these are options that I would recommend to explore. And this is how I've been using some of the principles of lifestyle medicine, fusing it with sort of my mindset approach to helping patients with long COVID in our service.